Okay, so good morning, everyone. First of all, I would like to begin by expressing my gratitude to the organizing committee for this invitation. It is an honor to be here today. My presentation focuses on a topic of critical importance, youth smoking trends in Greece, specifically among adolescents aged 13 to 15 years old, based on recent findings from the Global Youth Tobacco Survey, otherwise GYTS. Smoking among adolescents is not just a public health concern, but a growing epidemic with long-term consequences. The increasing rate of tobacco and electronic cigarette use, as well as the challenges in cessation efforts, underscore the need for immediate action. It is a crucial period when many lifelong habits are formed, and smoking poses a significant threat not only to the physical health of young individuals, but also to the well-being of our future society. Through this presentation, I hope to highlight the shift in smoking behavior among Greek adolescents and emphasize the urgency of targeted intervention to curb these worrying trends. These presentations aim to provide an in-depth analysis of youth smoking patterns in Greece, focusing on adolescents aged 13 to 15. It compares data from two key periods, 2013 and 2023, using findings from the GYTS study. The aim is to highlight how smoking behaviors, including the use of cigarettes and electronic cigarettes, as well as now the heat of no-burn products, have evolved over the past decade, as well as the impact of public health intervention and cultural shifts. We should we have now the two fact sheet compared, 2013 in blue at the left and in orange 2023. We should take into consideration the Empower implementation in Greece since 2007 and the fulfilling of the majority of target since 2016 for the country. It's extremely important to have in mind that our country is almost complying with the Empower principle. As we can see in this first slide, there have been a notable increase in overall tobacco use among Greek adolescents, including an increase in the use of electronic cigarettes. The findings suggest that while traditional cigarette smoking has risen slightly, the surge in e-cigarette use is reshaping the landscape of tobacco consumption. This trend suggests that increasing popularity and accessibility of alternative nicotine products among young people needs a very close monitoring and, of course, immediate implementation of prevention program. We should mention here that the category tobacco use in 2023, it is also included the use of heated products. The heated products were not available in the country in 2013. So we don't have data 10 years back. So cessation effort. These slides reveal a concerning decline in cessation effort among youth smokers over the past decade. Fewer adolescents are attempting to quit or expressing a desire to stop smoking, which suggests that smoking cessation campaigns may be losing their effectiveness or appeal. It's something that we should reconsider. Intervention programs that can re-engage youth. I'm sorry, I'm facing a problem with connection. I hope that everything is okay. Could you confirm that you are here? Everything is okay? Okay, thank you. I'm continuing. So these findings highlight the need for more targeted intervention programs that can re-engage youth in quieting smoking, especially in light of the growing prevalence of both traditional and electronic cigarettes. Second-hand smoke exposure. The data presented here show modest progress in reducing exposure to second-hand smoke in both domestic and public environments. While fewer adolescents report being exposed to second-hand smoke at home, exposure level in public places remain high. We should also notice that a new legislation banning smoking in public places is implemented in Greece since 2019. The statistics suggest that while legislative measures may be helping to create smoke-free environments, further efforts are needed to fully protect youth from the dangers of second-hand smoke, particularly in public spaces where enforcement may be lacking. Access to tobacco products. Access to tobacco products among Greek adolescents has improved slightly, with fewer young people successfully purchasing cigarettes from store and fewer bypassing age restriction. We can say that they are good news. However, the fact that a large percentage of adolescents can still easily access tobacco products is concerning. And it calls us for stricter enforcement of age verification and tighter regulation of sales, particularly in areas where their laws are not rigorously upheld. Awareness and attitude. These slides outline a significant reduction in the visibility of anti-tobacco messaging and a concerning drop in the perception of the harmful effects of smoking. These findings may indicate that public health campaigns have lost some of their reach of effectiveness among adolescents over the past decade. As fewer students report awareness of smoking campaigns and recognize the danger of secondhand smoke, it becomes clear that a revitalization of tobacco prevention messaging is needed, particularly through channels that resonate with younger audiences, such as, of course, social media. We know all that the access to social media, such as Instagram or TikTok for young adults, or young adolescent, it's starting at the age even of 11 years old. Summarizing the results of this preliminary comparison of the GYTS studies in 2013 and 2023, the major concern regarding youth tobacco use in Greece is the overall use of tobacco. With rising tobacco use rates and the growing preference for electronic cigarette, public health authorities face new challenges in combating nicotine addiction. The decreasing motivation to quit among adolescents exacerbates the issue, signaling the need for innovative strategy to curb the rising tobacco use and provide effective support for cessation. The conclusion highlights the mixed picture that emerges from the data. While efforts to restrict access to tobacco and limit secondhand smoke exposure have yielded positive results, the overall rise in tobacco use, particularly in electronic cigarette consumption, is troubling. The reduction in cessation attempts and desire to quit among adolescents suggests that existing public health measures needs to be reconsidered to meet the evolving landscape of tobacco use. The data call for an immediate focus on prevention, education, and cessation support tailored to the realities of today's youth. Nothing of this study, it cannot be possible if we don't have the support of the Greek team from University of Thessaly, of course, people from collaborators from a special academic unit for the study of smoking behavior of Laboratory of Hygiene and Epidemiology, of our Department of Public and Community Health on the School of Public Health, University of West Attica. And I need to address a special thanks because we start the study at the beginning of the end of pandemic. So it was extremely difficult, transportation, contact with people. We had a lot of limitation to overcome. And thanks to the effort of all our collaborators, we achieved our goal. Thank you very much for your attention, and hoping that our adolescents say no to any kind of tobacco use in the near future.